Welcome to Compassionate Conversations. The goal of our podcast is to explore topics related to serious illness. Ancora Compassionate Care exists to be a supportive presence for life's journey. We can provide care and support wherever a patient may be on their journey with a serious illness. Ancora Compassionate Care began as Hospice of Rockingham County in 1987. While our name changed in late 2023, we are still the local provider the community has always known. We'll always be there because we've always been here. Welcome to this edition of Compassionate Conversations. My name is Lynn Flanagan and I am the CEO at Ancora Compassionate Care. Today we have kind of taken our show on the road, if you will, and I have got such a special guest to introduce to you. Mr. Elwood Shreve has allowed us to come into his home, and he has got quite an interesting story to share, and we are just so appreciative. Thank you so much.
Thank you.
Tell me, and let's tell our listeners just a little bit about you, whatever you want to share about yourself.
Well, I'd like to start with how all this came about. In August, well, before that, I was going to my regular office visits with the doctors and everything, and every time I left, they said everything is just fine and so forth. And then in August, I made 5 emergency trips to the emergency ER, and then it seemed to go downhill pretty quick. Mm-hmm. From there, ended up in 6 days of having 3 different operations in 3 different hospitals. Wow. And in October, I was told by 2 surgeons that I might live till December. Maybe make it to Christmas, but would that be as far as it would go? And so when I left the hospital after being in one hospital for 5 weeks, my daughter brought me home, and as we were coming into the house, I totally collapsed. Mm. And she called the ambulance, and they came, and I was sitting there on the concrete right before coming in the door. And I looked up, and the ambulance came, and there's these 2 young girls, slim girls, and I looked and I says, what else is going to happen? Are you telling me these 2 are going to get me in the house? And so I came over there, and one of them looked down at me and looked me right in the eye and says, Mr. Shreve, you do exactly what I say when I say it, and don't do nothing unless I tell you to do it, and you'll be in the house. And sure enough, it happened just as she said.
How about that? And
so I was in the bed and thinking about my life and everything, and then the doctors had already done told me that I wouldn't be here any longer. And so hospice came in, and I'd already heard stories about hospice. Once you go with hospice, it's just a few moments later, you won't be nowhere. And so I was at that point. So when I guess, can I mention her name?
Sure. When
Carol came in, one of the representatives of hospice, the name was hospice at that time, she gave me a long talking to, and I had already pleaded before that just to take me to hospice and close the door. And
it was a hard time.
Yes.
Hard time.
And So after her talk, I said, okay, I'll try it your way. And so I started to recover, and I can say this, I didn't know as much about hospice as I thought I did until they started coming and caring for me. In the process of time, they changed their name to Ancora Compassionate Care, which really matched with what they really are. I never met one of them that wasn't as caring as can be. They treated me with dignity, respect, and they cared for me more than I've ever been cared for.
Oh man, Mr. Shreve, let's back up just a little bit. First of all, I just thank you for, again, letting us come in, but just trusting us with this story, because this is just a priceless story. When you first started going down this path, I think you touched on feelings that anybody would have when you get a diagnosis so it's scary, it's unsure, not sure what to do. And then when you told the story when you were sitting in the driveway and you had the thought, what else? What's going to happen? And I think that's an important part right there of how Ancora Compassionate Care, and you're right, at the time it was Hospice of Rockingham County, and we'll get back to that name change in just a second. But there's really no way sometimes for people to realize how much support, how much care that we can offer until you have to use the services. Is that a fair statement?
Yes.
There's just no way. And we certainly understand that. So that's another reason that I'm just grateful that you're willing to share your story, because I think this will help other people have a different mindset about what we do. So you had mentioned that you knew about hospice, you had heard some things in the community, I'm sure. And like you and I talked earlier, there is a negative connotation sometimes associated with hospice or end-of-life care. They're hard words to hear. That's a hard thing to think about. And especially being told, as you said, by two different surgeons, that your time might be short. There's research out there that I always like to share with people, because it goes in the complete opposite direction of what some of the misconceptions are. But there's a lot of research that proves now, and they've proven for years, that people who have hospice and the support of a hospice care team actually live, on average, they live 30 days longer than patients who don't have hospice. Well, I got to tell you, Mr. Shreve, you've even blown that research right out of the water. My goodness. So you mentioned Carol. Carol is one of our nurses. You also have the support of a hospice aide, I believe, Kathy.
Kathy, she's wonderful.
Yep. And then you also have a hospice social worker, Elantra, comes
Yes,
to
she's
see
nice,
you.
wonderful.
So let's start back where Carol gave you a good long talking to. Was it more about the quality of your life? Like how hospice can help improve that and help you accomplish whatever kind of goals you have?
Carol told me that nobody knows when you're going to pass away except God, and that He's not through with you yet, and that with you, I can't remember exactly her words was, but it was words of encouragement that you need to think about what you haven't finished doing yet, and to dwell on finishing what you have thought about. And I did do that, and then she encouraged me to think about something that I'd love to really do, and to follow up on that, and I have endeavored to try to do that, and that's writing.
Mm-hmm.
And she showed me in such a way that I could trust what she says and what I get. I'm trying to call it both ways.
That's okay.
But Ancora,
Mm-hmm.
Ancora Compassionate Care. She's trying to get me to see that it's not just her that's encouraging me, but it's the whole organization.
Mm-hmm.
That no matter who they send out here, no matter who they have picked, they're going to be the right one to care for me. And she really turned my life around, and I believe that. Everyone that's come in has helped me and encouraged me so much that, well, I didn't tell you, but I'm in the writing of a second book.
I love it.
And
that is awesome. So you had a goal, and you have quite an accomplishment to talk about. So while you have been a patient of Ancora Compassionate Care, you have written and published a book.
Yes.
And now you're working on book number 2.
Yeah.
I got to tell you, Mr. Shreve, you're kind of giving me a kick in the pants. I got some things I need to get in order for myself. How fantastic. So tell me about this book. What's the title of it?
Well, I have a copy of it right here. And the name of it is Unseen. It's a story that will keep you guessing all the way through. I'll show you that there's not one curse word. There's nothing in there. It's general reading for all ages. And the artwork in this book is done by a young girl that lives in Greensboro. I've never met her. And unknowing to me, as she was doing the artwork for this book, she was in a contest, rather, or I can't think of what you call it.
Just a competition?
Competition,
Mm-hmm.
There we go. And she won 5 first places in the state, and she won a national title in the national. And I still hadn't met her.
Wow.
The second book that I'm writing, I've already sent her a list of the pictures to draw, and she's already accepted the assignment. And so if nothing happens, that should be coming out in probably the end of August.
That is fantastic.
This is available. Mark's not here, my son, but he could tell you all the places available, but the one in particular is Lulu Bookstore, and that's in Raleigh. And you can contact it through that. Pull up the word Unseen. Mm-hmm. It'd be 2 listed there. Don't get the wrong one.
No, we need to get the right one. But let's think about that just for a second. How lives touch other lives. I just had a picture in my mind when you were talking about the young lady that did the artwork, and now she's won in competitions. But had you not written this book, she wouldn't have had the opportunity for this artwork. And perhaps if Carol, Kathy, and Elantra had not supported you, and Carol particularly had that several conversations with you throughout the care that Ancora's team has provided, maybe the book wouldn't have gotten written. I just had a picture in my mind of, you know how when you drop a stone or a rock in the water and just all the beautiful ripples that come from that. And I think that, for me, is why we're all here, to care for one another, love on one another, and support one another.
Right.
So, and you know, that was one of the many reasons that we changed our name from Hospice of Rockingham County to Ancora Compassionate Care, because we wanted to communicate even more so because we're more than just hospice. We have other service lines, but we wanted that compassionate word in there, and we wanted that care in there. There's so many ways that we support people, and we wanted to have a better understanding of what we do instead of just hospice, because it's more than that. It's much more than that. So I loved how you talked about the word compassionate being right on. That makes my heart happy.
That fits the people, really does.
That is awesome. So throughout this process, how has your thinking changed about how you were viewing hospice before we came in and now?
Well, excuse me, I'm sorry.
You're fine.
When I tell you this, you'll know that you'll see what impact it had, as you was talking about when you're dropping the pebbles. But I talked so much about Ancora Compassionate Care to so many people, and expressed how wonderful and great they are and how the name fits what they do, that my granddaughter, which is already a nurse, she decided to go with hospice in Virginia, and that would have never took place if it hadn't been for this. I guess everybody talking about how good y'all are.
So, thinking about one more way that this has impacted somebody. So now your granddaughter is a hospice nurse. I think that is just awesome. But I had asked you earlier when I first met you when I came in, how your thinking would have changed about hospice. It sounded to me that before you met Carol, before you met Kathy and Elantra and anybody else on our team, that your thinking about hospice might have been a little on the negative side.
Right.
And so now it seems much more positive viewpoint.
Yes, even when I was younger, I'm not old yet. Even when I was younger, anytime anybody mentioned the word hospice, I said, they may have 3 or 4 weeks left, that's it. And that's the impression I had of hospice. I had no idea that I had been visited nursing homes and been to hospitals and everything else, and saw how people are treated. I'm not saying all of them, but they don't give you the dignity and compassion that I come to find was here. It amazed me, and it still amazes me, that when they come right here, the compassion is there. You can feel it in your soul. And I would recommend anybody that's getting close to the point of needing outside help, or even any kind of help, to seek Ancora Compassionate Care first. Have a talk with them and just see how they are. You'll agree with me, I'm sure.
I do agree with you. But I'm a little bit biased. But I got to tell you, you just hit on a perfect point, because a lot of times in our healthcare system, it can be confusing. You see a lot of doctors. You yourself had 3 different hospitals in 3 surgeries in 6 days. That's a lot for people to try to process. So we are always happy if we can come help, just have a conversation and explain what we do. We are always happy to do that. It can be an unsure time, and it can be a scary time, but I think certainly the support that we can offer and all the different team members, we can help turn that around for people and make it as easy as it possibly can be.
Right.
And so I appreciate you sharing your story so very much, because I think it will go a long ways in helping people understand. We're going to be looking for this book. So can you give me a hint about the second book?
Well, to tell you the truth, deep down inside, this book is based on what I have observed. The title of the book will probably give you a pretty good hint. Is Love Chose Me.
Wow.
And you'll find out.
Okay. Well, I'm definitely going to be looking. And you said towards the end of August.
Yes.
Okay. So this is a huge piece of how hospice support can help as well.
Right.
Because this is quality of life.
Yes.
We're here in your house. You're not having to go back and forth to the hospital,
Oh,
not
my.
back and forth to the ER.
That's a delight.
I'm sure. So, and when Kathy comes in and she helps get you dressed and helps with your bath, that saves a lot of energy, I'm sure.
Yes, it does.
So, and helping you stay at home. Most of us, that's where we would rather be. We'd
I
rather
agree.
be in our own spot. Anything else that you would share with somebody if somebody is facing a life-limiting illness, but they're not sure about hospice or about making that call?
Well, they need to talk to you. I don't know what else I can say.
Okay, we'll just...
You've got all the answers. I would be interested in finding out how you get all of these people that are so compassionate. I mean, that's a rarity in itself.
You know it is, and I'm going to tell you something that I believe down in my soul. I think no matter what we do in this organization, whether it's people on the administrative side, like the business side of things, medical records or billing, whatever, right from our receptionists to the nurses, the aides, the chaplains, the social workers, I think you have to be called in your heart to do this kind of work. We are very mission-minded, and our whole mission statement is to be a supportive presence for life's journey, which I think you have definitely experienced that. But we have to have the right people to do this kind of work. You know, I got to brag to you just a little bit, but this organization, because of folks that just like your team that you have, Medicare has rated Ancora Compassionate Care as a 5-star organization.
Wow.
But I have to tell you, as the CEO, it's because we got 5-star people.
Yes, exactly.
And I am so privileged to work alongside them. I told you when I first met you that I'll always be a nurse first, hospice nurse first.
Right.
I am so appreciative of the role I get to play, but nurse in my mind comes before CEO. But your team members that come, I'm just privileged to work alongside them and with the calling, with that same mission-minded and that same heart. So that's how we get all these people.
Okay.
All right. Well, I thank you so much, and we're going to wrap it up. But I am so glad that you got to hear from Mr. Shreve and hear about his experience with Ancora Compassionate Care. If you would like any more information, you can give us a call at 336-427-9022.